Perform passive range of motion to the shoulder. Introduction. Range of motion exercises are done only with a doctor's order. They are performed to keep a patient from losing function while they recover. They are only done on the extremity indicated in the care plan. CNAs are not performing exercises to restore function, only to keep the patient from losing function. You will examine the patient throughout the skill for signs of pain. If the patient has pain, you will only progress with the exercise to the extent that the patient is comfortable. Ask the patient frequently about pain. Every exercise will be performed 3 times. You will always return the extremity to the starting position before continuing with the next repetition. Make sure you are performing a full range of motion up to the point of pain and moving the extremity slowly and smoothly, supporting it fully. When lifting a body part, it is important not to grab the extremity with an overhand claw-like grip. Use the flat palms of your hands or an underhand support whenever possible. Using a flat hand reduces the possibility of bruising or tissue damage. The care plan will tell you what arm to perform exercises on. Because this is done only with a doctor's order, it is critical that you perform the exercises on the correct extremity. Performing these exercises on an arm that has just had surgery or has a medical issue like a blood clot can cause serious injury. The care plan will indicate if the exercises are to be performed on the patient's right or left arm. The patient's right and left are different from yours. Pay attention to choosing the correct extremity. Explain to the patient in plain language what you are going to be doing. This helps them understand what motions you will be performing and helps gain their trust and cooperation. When performing range of motion to the shoulder, we are going to perform the following exercises to this joint. An easy way to remember this is USA. The U stands for an up-down motion, which is a flexion extension motion. The S stands for side-to-side, or an abduction-adduction motion. And the A stands for around, or a rotation motion. The first exercise on the shoulder is a flexion extension, or up-down motion. This looks like the patient is asking a question. The arm will be extended all the way up and then returned to the bed. This motion is repeated 3 times. The second exercise on the shoulder is an abduction-adduction motion, or a side-to-side motion. This looks like the patient is making a snow angel. The arm is brought all the way out to the side until straight and then returned to the bed. It will be repeated 3 times. The final exercise on the shoulder is a rotation motion or an around motion. The arm is rolled forward and backward like rolling cookie dough. The upper and lower arms should be rolled together so the patient feels the rotation in the shoulder. This motion is repeated 3 times. A recap of all 3 shoulder exercises, each repeated 3 times, is an up-down motion that looks like the patient is asking a question, a side-to-side motion that looks like the patient is making a snow angel, and an around motion which appears as if you're rolling cookie dough. After all 3 exercises have been completed on the shoulder, you will perform your closing. You will give the patient the call light, open the privacy curtain, ask if they need anything else, and make sure they're comfortable. Wash your hands and review the steps of your skill, and finally tell the evaluator your skill is complete. Watch the instructional video for step-by-step instructions on how this skill is performed. Then try the skill on your own.